Our first speaker is CDC Director Dr. Tom Frieden.
Good afternoon, everybody, and thank you for joining us. As you've been hearing from us, Ebola is a serious disease. It's only spread by direct contact with someone who's sick with the virus, and it's only spread through body fluids. The incubation period is 8 to 10 days after exposure, can be as short as 2 days or as long as 21 days. It's a severe disease which has a high case fatality rate even with the best of care. But there are core, tried and true public health interventions that stop it. Today, we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States. This individual left Liberia on the 19th of September, arrived in the U.S. on the 20th of September, had no symptoms when departing Liberia or entering this country, but 4 or 5 days later, around the 24th of September, began to develop symptoms. On the 26th of September, initially sought care, and Sunday, the 28th of September, was admitted to a hospital in Texas and placed on isolation. We received in our laboratory today specimens from the individual, tested them, and they tested positive for Ebola. The state of Texas also operates a laboratory that found the same results. The testing for Ebola is highly accurate. It's a PCR test of blood. So what does this mean? The next steps are basically threefold. First, to care for the patient, and we'll be hearing from the hospital shortly, to provide the most effective care possible, as safely as possible, to keep to an absolute minimum the likelihood, the possibility that anyone would become infected, and second, to maximize the chances that the patient might recover. Second, we identify all people who may have had contact with the patient while he could have been infectious. And remember, Ebola does not spread from someone who's not infectious. It does not spread from someone who doesn't have fever and other symptoms. So it's only someone who's sick with Ebola who can spread the disease. Once those contacts are all identified, they are all monitored for 21 days after exposure to see if they develop fever. If they develop fever, then those same criteria are used to isolate them and make sure that they are cared for as well as possible so that they maximize their chances and to minimize or eliminate the chance that they would infect other people. The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here. It does reflect the ongoing spread of Ebola in Liberia and West Africa, where there are large numbers of cases. And while we do not currently know how this individual became infected, they undoubtedly had close contact with someone who was sick with Ebola or who had died from it. In West Africa, we are surging the response not only of CDC, where we already have more than 130 people in the field, but also throughout the U.S. government. The President has leaned forward to make sure that we're acting very proactively there, and the Defense Department is on the ground already strengthening the response. We're working with USAID and other parts of the U.S. government, as well as with a broad global coalition to confront the epidemic there. But ultimately, we are all connected by the air we breathe, and we are invested in ensuring that the disease is controlled in Africa, but also in ensuring that where there are patients in this country who become ill, They're immediately isolated, and we do the tried and true core public health interventions that stop the spread of Ebola.
Thank you, Dr. Frieden. I'd like to next introduce our second speaker, Dr. David Lakey, Commissioner of the Texas Department of State Health Services. Dr. Lakey.
Good afternoon, everyone, and thank you, Dr. Frieden. Thank you for your support, the support of the CDC as we work through this current situation. As I start off, I first want to say our thoughts and prayers are with the family and with the patient and the treatment team for this individual. Our laboratory, the Texas Public Health Laboratory in Austin, has a specially trained team to handle high-risk specimens like this. We were certified on the 22nd of August to do Ebola testing. At 9 o'clock this morning, we received the blood sample. All the controls were within the expected ranges, and the PCR was definitely positive for Ebola Zaire, and we got that result back at 1:22 this afternoon. I want to reiterate that we have no other suspected cases in the state of Texas at this time, but we are closely monitoring the situation, and we're ready to assist in any way that is needed. We've been in significant contact with the hospital, with the local health department, and the CDC, and they have our full support as we work through this situation, and we're committed to keeping Texas safe. So again, I want to thank the CDC, the local health department in Dallas County, and the hospital for the work that they're doing, and we're working through this situation together. Thank you.
Thank you, Dr. Lakey. Our third speaker is Dr. Edward Goodman, the hospital epidemiologist with the Texas Health Presbyterian Hospital, Dallas. Dr. Goodman.
Thank you. Thank you to Dr. Frieden, Dr. Leahy, the CDC. I want to correct one statement that may have been misinterpreted by Dr. Frieden when he commented on the air we breathe. Ebola is not transmitted by the air. It is not an airborne infection. Texas Health Dallas is a large community hospital with a robust infection control system that works in close cooperation with the Dallas County Health Department, the Centers for Disease Control, as well as other epidemiologists within the system and in the community. We have had a plan in place for some time now in the event of a patient presenting with possible Ebola. Ironically enough, in the week before this patient presented, we had a meeting of all the stakeholders that might be involved in the care of such a patient. And because of that, we were well prepared to deal with this crisis. Thank you.
Thank you, Dr. Goodman. Our final speaker is the Dallas County Health and Human Services Director, Zachary Thompson. Director Thompson.
Good afternoon. Our hearts and prayers go out to the family as well. I want to thank Dr. Frieden, CDC, Dr. Leahy, Department of State Health Services, as well as Texas Health Presbyterian for our response to this case in Dallas County. I also want to commend Dr. Christopher Perkins, our Medical Director, Health Authority, and our EPI team for their work that they have been doing in conducting public health follow-up on the patient, which includes contact investigation to gather information based on the patient's travel history, activities, and close contact. Dallas County Health and Human Services will proceed with the public health follow-up per CDC guidelines. And Dallas County Health and Human Services wants Dallas County residents to be reassured that your public health is our number one priority. Dallas County Health and Human Services staff will continue to work hard to protect the health and welfare of the citizens of Dallas County. Thank you.
Thank you, Director Thompson.